Hi, my name is Nikki Ryan. My student ID is 3075761. So now we're going to talk about mouse and rat care. They have a lot of similarities in between them as far as their care goes. Obviously, there are really big differences in size. To start off with, I have mice here, but for the same housing rules generally apply to rats, only obviously they need a larger cage. But you want a solid bottom. You want the sides and or top. The top does not have to be, but definitely the sides want to be wired so that they have plenty of ventilation. People call this the solid bottom, the shoebox cage, but that's definitely a good choice. A rat obviously would be way too big for this cage that I have here. You would want one that's of appropriate size. Bedding wise, you can have anything soft material. You don't want any hardwoods. Hardwoods actually have compounds that mess with their hepatic enzymes, so you want to avoid any soft woods like cedar or pine or anything like that. As far as enrichment, you want to make sure that they have plenty of toys. Mice and rats are both chewers, and they also love to forage. These mice have toys, but they have buried them, so you can't see them on there. But also any type of like shelter or housing, they love any type of cover. So in the way this cage is set up, it's up here, but sometimes people put little houses in the cage itself. You want to make sure that they have food at all times. In general, you can free feed mice and rats. You do be careful of watching out for obesity and overeating, but in general, rodents don't really overeat. With rats in particular, you want to make sure that you have a quieter area. Rats are prone to audiogenic seizures, so you want to make sure that the area is quiet. You want to make sure that it's free from any predator type action, like if you have a cat in the house. And then you also want to watch the humidity for rats. Rats develop a disease or a condition known as ringtail when the humidity is super low. So you just want to watch for those things as far as environment goes. As far as I went over kind of bedding, you want to make sure there's lots of chew toys. Rats and mice are what they call hypsodontics, where their teeth continue to grow. So you want to make sure that they have chew toys to kind of keep the teeth blunted down. You don't want to have any overgrowth as far as that goes. They also like to forage, so you want to make sure you have plenty of areas for them to do that. For identification, mice and rats, you can, for non-permanent, for temporary identification, you can use cage cards. You can also use any type of non-toxic marker for them. You can also, there are ways that you can shave patches on the fur in order to show identification. Permanent-wise, you can use microchipping, tattooing. They also have an ear punch system. It's a way that they cut holes and notches in the ears in order to number them. That is good up through numbers up to 99. Anything over 99, they tend to do what they call toe clipping, where they'll actually cut off the first joint of the toe. If you do that, it's, I wouldn't call it ideal, but if you need to do that, just make sure that you are doing it as an anesthetized procedure, because it is painful and stressful for them. Mice and rats are actually spontaneous continual ovulators. So the females, they don't need a male present in order to ovulate. They also don't tend to ovulate according to season or light exposure. And they do have short duration of gestation period when they do get pregnant. Mice, it tends to be upwards of 19 to 22 days. Rats tend to be the full 21 days for gestation. While most things with mice and rats tend to be similar, mice in particular do have a thing that they notice. One is called the Winton effect, and it's actually where they will go into anestrus. Even though they will spontaneously ovulate, they will go into a period where if you have an all-female colony, they'll all go into an anestrus period, and then once introduced to a male, they'll start into estrus within 3 days of being introduced to the male or a male scent. That's known as the Winton effect. The other thing kind of more common with mice as opposed to rats is they do have, if you have bred a mouse and it's within 4 days of conception, the mice, if you introduce a new male scent to the mouse, then she'll actually abort the pregnancy just based on being exposed to the scent, and that's known as the Bruce effect. Some species of rats do this, not all, but most mice tend to do this. So now I'm going to give a sub-Q injection. That just means we're going to place a medication or fluid underneath the skin. And I'm just going to take my syringe, make a little tent with the extra skin at the scruff. And we're just going to place it in, aspirate, and I'm not getting anything back, so I'm just going to push the fluid in, hold it, and then just check for any leakage. So I'm going to administer an oral medication to our friend here, and all I'm going to do is grab the scruff, which will help to open their mouth, place my medication between on the side of their mouth, and just gently put it in there. And he swallowed greatly. Good baby. So we are going to obtain a blood sample from the tail vein of our friend here. And one way to help the blood dilate down to the tail is to just let it sit in some warm water. It just has to be for a couple seconds. Alright. And then Jenny here is going to help restrain. And I'm just going to dry the tail off. Hold on, sweets. We're going to use alcohol to help clean the skin surface. And then just let it dry. I'll just catch that real quick. Alright, and Jenny's going to hold off on the vein. Hold on, hold on. Gently insert. And we have blood. Restraint procedures for mice. If you are lifting them from one cage to another within a quick amount of time, you can pick them up by the base of their tail. You don't want to do this for prolonged periods for general restraint, and you don't want to hold their tail too tight or you can cause damage to the tail. But for general things, they do have a scruff where you can actually hold them by the scruff. And then actually, in order to do like our intraperitoneal injections, you want to hold one hand with the scruff and actually hold them by the back of the tail base, just like that. As far as determining sex on mice and rats, the females tend to have a shorter area between their urogenital area and the anal area. Males tend to have a longer distance, as well as most of the time you can see the scrotum below there. So I'm just going to show you on Raindrop here. She is a female, we do know that, but I will show you an example of how we sex them. So I'm just going to restrain her over. Oh, I know, I'm sorry. What she is not too happy about. So right there in her little genital papillae and then to her anal area is super short. A male would probably be much longer. Also, the females do have nipples, whereas the males do not. So now I'm going to demonstrate a sub-Q injection on Raindrop. It's the same concept as for most other animals. You just want to make sure that you go in the sub-Q area. You don't want to go straight down and hit the muscle. You don't want to go straight through the other side of the skin so that they don't get the injection. So I have my sterile saline here. And we're just going to... Sorry. It's okay. Pull up the scruff and make a little tent. We're going to insert the needle. I know. We're still in. Oh, all right, we'll pull out.
Raindrop, come on.
All right,
there we go.
Now that she's settled down, I don't want to cause any lacerations. But stick the needle into the skin, aspirate the syringe, and give the injection. Now we're going to do an intraperitoneal injection on Raindrop. That's an injection where you want to get in the abdominal cavity, but you don't want to hit an organ. In Raindrop, we're going to do it in our lower left. It's actually her lower right quadrant. So I'm just going to take the leg to stabilize that out. I'm going to take a little alcohol swab and allow that to dry a second. I'm just going to insert the needle gently, aspirate back, and I'm not getting any blood or fluid. And then I just depress the syringe and draw out. In order to give an oral medication to a mouse, all we're going to do is hold, this is Raindrop here, who is not wanting a medication. I'm going to try to get her in my non-dominant hand. So to give a medication, you just hold them by the scruff, and we're just going to take a syringe with our medicine and just gently place it in their mouth. And she drank it right up. So now I'm going to discuss rabbit care. We talked about rats and mice before, and rabbits actually, they can have a solid bottom cage, but they can also have a mesh bottom cage, one that you can put a tray underneath, which will catch any urine and feces that they have. It also makes it super easy to clean, as well as being a little bit more hygienic so they're not sitting in it. You do want to avoid any, well, they can be litter box first off, and then you do want to avoid any clay litter or any shavings or anything like that, because they tend to eat that stuff, and you don't want them to get blocked or anything. Temperature-wise, they really like cooler temperatures, like 62 to 70 degrees. Something to keep in mind if you're going to have some outside, but also in your house. Just they tend to get a little more distressed with higher heats than other animals do. Nutrition-wise, any type of pellet food like this is great. You want at least 10% protein. Rabbits also sometimes have issues with hairballs. If that happens, you can just add a little fiber to their diet. They have some diets that are higher fiber. Also, what you can do is add a proteolytic enzyme. That's just something like pineapple juice or papaya juice. You can soak their Timothy hay in that, and that can also help with any hairball issues. A lot of people tend to want to feed rabbits a lot of raw vegetables. They actually have little nutritional value for rabbits, and rabbits do tend to overeat when food is available just freely for them. So if you do want to feed them any raw vegetables, just to keep it to a couple times a week to avoid any obesity. Identification for rabbits. Temporary identification can be cage cards. You can also use some non-toxic markers. Permanent identification, they can be microchipped. They can have tags in their ears, and they can be tattooed. If you are going to tag them for any ID purposes, generally if it's a general identification, you want to use the left ear, because most often the breed registries use the right ear for tagging for identification. Restraint on rabbits can be a little tricky. They are, as a defense mechanism, they want to try to kick you, which can cause fractured vertebrae and paralysis of their rear. Most of the time there's no treatment for that. It's just euthanasia. So you just want to be careful when you do hold them and handle them. Most of the time, if you're going to restrain, I'm fine with Thumper here. He's just kind of chilling. But if you want to restrain for any treatments, you do want to always keep their rear legs close to your body like that. Don't panic if they do start kicking, because that's the last thing you want to do. And then you can just grab the back of their scruff just like that. And just make sure you keep them up against your body, and these rear legs can't get above your arm to try to kick. Also, you can use a towel. And what you want to do with the towel is you can just make a little bunny burrito. So I'm going to lay out my towel. I like mine to go kind of perpendicular to the bunny. And then just kind of let them chill. You can take things slowly. And then you just want to wrap them in a burrito like that, and that way their legs and their body is contained, and you can just worry about containing their head. The last type of restraint that you can do is dorsal recumbency in rabbits. Thumper has been here with us all day, and I think he's just either it doesn't work as well for him, or either he's just kind of lost his patience with us. But supposedly when you lay them back in dorsal recumbency, they kind of can become in a trance-like state, which they stay calm. You can talk to them in a smooth voice. But our friend Thumper here, I think he's kind of tired of hanging with us today, so I will not be able to show you that. So now I'm going to talk about rabbit reproduction and also show how we determine the sex of rabbits. Females are actually induced ovulators, so if you have a colony of only females, they'll actually stay in anestrus. Once a male is introduced, they actually ovulate 10 hours post-coitus, and gestation is usually 29 to 35 days on the females. You know that they're getting ready to deliver. They'll start to nest, and in order to make the nest, they'll actually start pulling the hair from their sides and abdomen to make the nest. Parturition is called kindling in rabbits, and generally it's in the early morning hours. The other thing to know is female rabbit milk is actually very rich, so they actually only nurse their babies for a few minutes every day, and that's plenty enough for what the babies need to survive. Also with females, pseudo-pregnancy is very common. And then, so to talk about determining sex, the females tend to have a slit-like opening, and if you apply digital pressure, you'll actually kind of fold back the mucosa of their vulva. Males have more of a circular opening, and when you apply digital pressure, it extrudes their penis. Obviously, intact males, they have a hairless testicles or scrotum that you will see. Our friend Thumper here is actually, he's been castrated, so we won't see testicles, but I'm going to show you how to extrude the penis so we can see. And he's a male. So we're just going to put him in dorsal recumbency. And then we're just going to, and there's the penis right there. Now I'm going to show how to give a sub-Q injection. We're going to place the injection in the back of the scruff. Jenny here has Thumper burritoed and properly restrained. And then we're just going to pop it in the scruff right here. You don't want to go straight down because you don't want to hit muscle tissue. You also don't want to go straight, angle your syringe like this because you'll go straight through the other side of the skin. So we're just going to kind of pull up the extra skin and make a tent. Go at a 45-degree angle. Place it in. Aspirate. No blood comes back. And then we just gave the syringe. And then just hold the skin for just a second and check for any leaking. So we're going to draw blood from Thumper. I have a sterile insulin syringe. I have an alcohol gauze pad and then a dry gauze pad to hold off the ear vein when we're done. We do tend to draw blood out of the ear veins. It is recommended to shave, but for demonstration purposes, I'm not going to shave today. We're just going to come in here. And I'm going to take my cap off, wipe it with alcohol. Jenny's going to hold off for me. And there's our blood sample. So Merlin wasn't too happy at going into the towel, but I finally did get him. And so the restraint, we use a towel. And we want something that's not too thick that you can't feel the amount of pressure that you're holding him with. You want to take your thumb and your forefinger and put it at the sides of his head so that you can control his head but not to cut off any of his airway. I do have extra towel hanging in front in case he wants to bite. Not only does it protect my fingers, but it also does provide a little bit of distraction for him. And then to create some security for him, I just put my finger over his feet so that he has like a perch to hold on to. So now we're going to trim Merlin's nails. I have Resco trimmers, a little bit of gauze, and then some quick stop if I were to click him. Jenny here has got him in the correct restraint pose, so we are just going to take one of his legs. You're okay, right? And I'm just going to grab the Resco trimmers, and we're just going to take a little bit back at a time. There we go. All right, Merlin, I know. There we go. 2 more to go, Merlin. And we're just kind of going with the curvature of the nail. And just getting the tips. Okay. Alright. Now we're going to talk about bird care. This is Merlin here. When somebody brings a bird into the vet, the first thing you want to do is kind of just observe them in their cage. You want to make sure that the cage is big enough. The cage should be in general wider than it is tall. You want to make sure that they have plenty of space to actually spread out their wings. That's when you know it's the correct size. If you see somebody bringing a smaller one, ask them if it's like a travel cage, because some people do bring them in cages just to come to the vet and back, and just ensure that they have something bigger at home to stay in. The other thing you want to make sure, as far as enrichment, you want to make sure that they have plenty of toys, several different perches of varying sizes and materials. Birds are prone to getting pressure sores on their feet. So sometimes you can see how Merlin here has the straight dowels, but then he also has this one, which is a bunch of little rods sticking out. So that creates some variety for him. As far as you want to observe their posture, as far as how they're acting. It's normal for them to be stressed. They're in the vet. They may not come to the vet very often. So you want to look at their posture and just see how comfortable they are. See if there's any respiratory distress going on. Some signs of that would be increased respiratory rate and panting. This is normal if you've handled them, for them to pant and breathe heavier, but they should return back to normal breathing within a few minutes. They shouldn't stay distressed. The other thing you want to check for in their, as far as their cage goes, is their droppings. Bird droppings have three parts. They have the white part, which is the urates. They have the brown or solid material, which is the feces, and then they have a liquid portion, which is the urine. You want to make sure that in general, all three of those should be in every single dropping. Sometimes if they're on an all-seed diet, the droppings could be a little drier than usual, but you should always get that checked out in case there's anything else going on. As far as Merlin's condition, we want to look at feather condition. A common thing for birds to do is to pluck their feathers. Sometimes this is due to underlying disease, so anytime you see a bird that starts to have feather plucking, you want to make sure that you get a full workup on them done to make sure that there's no health issues going on. If you do rule those out, then you can start talking about environmental conditions, things that would stress them out at home, any nutritional deficiencies, anything like that. As far as nutrition goes, they should be a 70% pellet diet, and then 30% fresh fruits and veggies. So back to his body condition, you want to make sure all the mucous membranes are clear. You want to make sure that he doesn't have any masses, scaly skin, anything like that would be abnormal. What else? Birds should also always have a calcium block in their house. And some people think that birds need grit in their food. Actually, only poultry and pigeons really require this. It tends to increase the digestibility of their food, but most of our companion birds, actually, it causes them to be impacted. So some people might think that they need the grit, but they actually don't. Yeah, I think that's about it.